Why is high blood pressure called the silent killer?
High blood pressure, a serious cause for concern. However, there is no need to become depressed or lose hope, because that will only worsen your condition. Today, there are many effective treatments available, provided you consult a specialist in time. This allows the disease to be stopped at an early stage. This was reported by the medical portal Orthodox. Doctors do not prohibit using folk remedies to lower blood pressure, but consulting a cardiologist or therapist is strongly recommended. Treatment should always be monitored by a healthcare professional. Folk remedies for lowering blood pressure. To normalize arterial blood pressure, it is recommended to drink 25 g of freshly squeezed chokeberry juice daily for 2 weeks, or to consume about 10 berries a day. Garlic infusion is another method for lowering blood pressure. To prepare it, crush 2 heads of garlic, pour 250 milliliters of water over them, and let it infuse for 12 days. The tincture should be taken 3 times a day, 20 drops each, 15 minutes before meals. The course of treatment lasts 3 weeks. Dates are also beneficial in reducing blood pressure. It is recommended to drink 3 glasses of freshly squeezed date juice daily. Blueberry infusion can also be used to treat hypertension. To prepare it, pour 1 glass of boiling water over 4 tablespoons of dried blueberries and let it infuse for 8 hours. Drink 1 glass daily. In acute hypertension, when blood pressure suddenly rises, it is recommended to apply small pieces of cloth soaked in vinegar to the heels. Once blood pressure decreases, the cloths should be removed immediately, as there is a risk of blood pressure dropping too low. Comprehensive measures. There are many folk remedies for reducing blood pressure, and each may provide some effect. However, to achieve real results, several important rules should be followed. If you struggle with excess weight, now is the time to normalize it. Completely give up alcohol, tobacco, tea, and coffee.
Can daily habits really lower blood pressure?
Diet. Dietary approaches to stop hypertension. The diet is widely recommended by doctors worldwide. It emphasizes vegetables, fruits, whole grains, lean proteins, and low-fat dairy while limiting red meat, sweets, and sodium. Research shows it can reduce systolic blood pressure by 8 to 14 millimeters of mercury. Salt intake. The World Health Organization recommends limiting salt intake to less than 5 grams per day. Too much sodium directly increases blood pressure by retaining water in the body. Potassium-rich foods, bananas, sweet potatoes, spinach, beans, and avocados help regulate blood pressure by balancing sodium levels in the body. Physical activity. Regular aerobic exercise such as walking, swimming, or cycling for at least 150 minutes per week can significantly lower blood pressure and strengthen the heart. Stress management. Chronic stress is a silent factor in hypertension. Practices such as meditation, yoga, deep breathing, and mindfulness have been proven to reduce blood pressure naturally. Sleep. Poor sleep increases the risk of hypertension. Adults are advised to sleep 7 to 9 hours per night to maintain heart health. Hydration. Drinking enough water throughout the day helps maintain proper blood circulation and prevents blood pressure spikes. Limiting processed foods. Processed foods often contain hidden sodium and trans fats, both of which contribute to hypertension. Reading food labels carefully is essential.